What's going on, guys? It's Nurse Bass coming at you today with this beautiful collaboration video that I have set up with the awesome Rachel P. That's correct. And today we wanted to talk to you about clinical do's and don'ts in nursing school. And be sure to stay tuned to the end of the video where you can hear a special message from Rachel. And then be sure to go check out her perspective on the topic after this video is over. So I've got like 5 tips, 5 do's, and I've got about 4 don'ts for clinicals in nursing school. So let's go ahead and get into it. So my first and number 1 tip, my first do is be prepared. That's the most important thing. The night before, you want to make sure that you have your little clinical bag all packed and ready to go. Make sure you have your stethoscope, BP cuff, pen light, everything that you're going to need. Make sure you have it all packed up. That way when you wake up, you get yourself ready for the morning. All you got to do is grab that bag and head out the door. The last thing you want to do is show up to your clinical site and like have forgotten your name tag or something like that. That's always the worst. Then you got to turn around, you miss clinical time, go home, get what you forgot. So being prepared is number 1, and it just communicates that you can be the professional nurse that they're asking you to be. Number 2, make sure that you get some good sleep the night before, and also eat something when you wake up. I don't care if you're not a morning person. Make sure that you get something in your system before you walk out the door to go to clinicals. Preferably something healthy, you know, something light as well. Maybe some light pancakes, fruit, whatever, with some whipped cream, Cool Whip, whatever. Just something light, something to sustain you, to get you going, to get you energized, to get your day off to a good start. And that sleep is vital. I'm probably one of the worst about getting sleep the night before clinicals. I can never seem to get any sleep. I'm always anxious or whatever, excited about the next day. But sleep is very important. You want to make sure that you're functioning at your highest level possible whenever you're going in here and taking care of patients. The next tip, make sure that you arrive early. That's also very important. It communicates to the teachers, because teachers take notice. Your clinical instructors, you show up early. You know, it communicates, again, that professionalism that you have come to work. And, you know, they really take notice of the people who show up late. That has happened quite a few times in my clinical group, and you don't want to be that person. It just looks sloppy. It's definitely unprofessional. You want to communicate professionalism. And plus, arriving early is also good. You know, you get there early, you can sit in your car, whatever, unwind, because a lot of times, at least for me, you know, your nerves are kind of high, like I said, kind of anxious. And, you know, it just gives you time to sit there, calm down, you know, and get your mind right and get prepared for this day ahead of you in clinicals. So I think that showing up early is definitely very important. The 4th tip, and this one is very important, make sure that you come to learn. Don't come to just get it over with, so to speak. There have been several people that I have noticed who, you know, it's like, oh man, I got to wake up really early, like at 7 o'clock in the morning, 7 o'clock clinical, and I got to wake up early and I'm just tired and I didn't get much sleep the night before, and I would just love nothing more than to get this day over with. Which is an understandable feeling, you know, you're sleepy, you're fatigued, what have you, but you want to make sure that you come to learn. What you need to do, in my personal opinion, is you need to look at these clinical days as your training to become a nurse. You basically have 2 years worth of clinicals, 2 years worth of training to become a nurse. And the last thing that you want to do is slack off or take a day off on one of your clinical days. You want to come to learn, soak up as much information as possible. This is the best time to do it. You can sit there all day in a classroom and read about how to give an injection in a textbook or how to insert an NG tube, what have you, but nothing is as good as the hands-on experience, that kinesthetic process. So make sure you come to learn, have that mindset that I'm going to learn something new today, and it will happen. And the 5th tip, which kind of goes along with that, be professional, okay? And just soak up as much information as possible. You want to be professional. You want to begin to mold yourself into that nurse, you know. A lot of times for a lot of people, especially like myself, I have never held a job in healthcare, so it's good to begin to develop that that nursing personality, that professionalism, how to communicate properly with patients in a professional manner. You know, kind of doing away with your old self and taking on that new clothing, that new nursing clothing. So definitely be professional. I know it's something that it seems kind of obvious, but I think it's something that is important that we should try to keep in the back of our mind and just maintain that level of professionalism as we approach our clinical day. Now let's talk about the don'ts. I think I have 4 of them written down. The don'ts are a lot more important than the do's. I feel like you can learn a lot more from mistakes than you can from victories. So let's get into the don'ts of clinical. Number 1 tip, Do not forget to brush your teeth before you leave your house and go to the clinical site. That is the worst. I have done it. Yes, I've done it by mistake. You forget to brush your teeth and your day is ruined. You want to make sure you brush your teeth because you don't want your clinical instructor, all of your classmates, to you just killing them with your terrible breath. And then your patients especially, that's the worst. And it's just, you forget to brush your teeth. You leave the house, you get halfway there and you realize it. And it's like, oh, I wish I had some gum or something. So it's just kind of puts a damper on your day. Make sure you remember to brush your teeth. Tip number 2, do not waste time. There are a lot of times, especially maybe in your first or second semesters, where you only have one patient, and it's hard not to waste time because all you have is one patient to care for, and you can't really be attached at their hip all 6, 8, 12 hours. So what I suggest is, if you're not in the room doing, giving your patient medications or, bed bath, or whatever it might be, if you're not giving them anything at the time, get on the computer, look up their history, look up their medications, any diagnostic procedures that they've had, any labs that they've had drawn, and just try and cultivate some knowledge. Try and get familiar with what it's like to look at laboratory values and try and connect the dots between their disease process and what certain lab values mean. I think it's very important just to not waste time. That way you're really maximizing your time at the clinical site and really getting the most from your clinical experience. Number 3, don't be shy. I know a lot of times whenever we have to shadow a nurse, it's kind of overwhelming. Like, you don't really want to ask them questions because they could have 4, 5, 6 patients and really be busy that day, and you would feel bad if you ask questions. Don't nag the nurses, but don't be shy. Don't be afraid to ask questions because that's their whole purpose of being there. You don't know what's going on. You might have some background knowledge, but you don't know everything. And these nurses are a great resource, a great tool for information, and that's really what they're there for. So don't be afraid to ask questions. If you have a question about why they're giving this medication or how this procedure works or anything, don't be afraid. Don't be shy. Just freaking ask it, man. Just get over that shyness, and you'll have a much more rewarding clinical experience as a result. And my 4th tip, and this actually might be my most important, don't worry. It's really hard to do. We get anxious and nervous about things, dealing with patients and interacting with family members and things of that nature. And it's hard not to worry. It's almost second nature. It's a second personality of a nursing student to worry and be nervous and everything. But try your best not to worry. Everything is going to be okay. You're going to survive it. It's not going to be the end of the world. Just go in there, apply the knowledge that you've learned, learn some more while you're there, and take care of the patient as safely and as effectively as you can. And everything else will work itself out. I hope you guys enjoyed this video. Make sure to stay tuned here in 2 seconds. You're gonna hear a special little message from Rachel P. And make sure to go over and check her channel out and check out her perspective on the clinical do's and don'ts. I hope this was helpful for you all. Comment down below. I'd love to hear any of your advice and tips as far as clinical do's and don'ts. As always, it's Nurse Bass, and I'll catch y'all in the next video. Peace.
Hey guys, it's Rachel. I hope you enjoyed this awesome video from Nurse Bass. Once you are finished liking his video and subscribing to his channel, definitely head on over to my channel and check out my video on my 5 clinical do's and don'ts. See you soon.